Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading health experts for your journey to prime health in life and in business. And in today's episode, it's going to be great because our guest is Dr. Joe Sherman, where he specializes in matching your soul to your role in healthcare. And I'm really excited to learn more about that. Before we dive in with Dr. Sherman, though, a message from our sponsor, Grow Solutions, because brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. We eliminate headaches such as new patient or new client lead generation, patient communication breakdowns that may happen, some operational chaos that oftentimes take place in practice. So we've got some proven systems and frameworks. And yes, we help you implement AI because it's coming, whether we like it or not. Grow Solutions is not an agency or vendor. We are your partner in growth. So if you've ever said this or you've heard yourself thinking this way, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your solution. Just drop the word grow below or feel free to reach out to me on any channel. Now, you're here for a purpose, and that's to see our guest. I'm excited to introduce you to Dr. Sherman. So Dr. Sherman, welcome to the Prime Health Podcast. And if you don't mind, please give us a little bit about who you are and then share with us, what we are expecting to learn from you on today's podcast.
Thank you so much, Derek. I appreciate the opportunity to talk with you and to discuss what I do and how it might be helpful to your listeners.
Yeah.
I am a pediatrician, a general pediatrician. I've been a pediatrician now for about 38 years or so. I have been out of clinical practice, I would say, for the past 5 years. Mostly just filling in here and there, perhaps. But my primary role now is as a physician coach and retreat and workshop facilitator for medical teams and individual health professionals. And most of my work is done with individuals coming to me, all kinds of health professionals, but primarily physicians, whether they be chiropractic physicians, osteopathic or whatever type of physicians, as well as other healthcare providers, and the areas of career discernment, of burnout mitigation, of leadership and mindful leadership, and personal growth. So those are the areas that I primarily focus on. I work with medical teams in areas of trying to become more collaborative, try to establish a culture of belonging amongst the team, and to try to get the most out of the talents and gifts of each team member.
Yeah. Well, it's interesting because we've had 2 conversations prior to starting the podcast, which have been great. And knowing that you're a pediatrician, but as I said, your voice is great. It's very soothing. I can only imagine how that helped with you being a pediatrician with kids. Like, I know when we brought our son in, he was always scared, didn't know what to expect, but I'm sure somebody with your stature and the voice that you have is very calming. And I'm sure that works now for you in your second career, if you wish, of helping people get past that burnout stage or that, what am I really doing here? So I'm excited for people to hear and see what you have to say along the way. So
thank you. Very kind.
You're welcome, sir. So I always ask this question to begin with. Was there a moment in your life or a circumstance that took place that put you into the career of medicine?
Wow. Well, this happened, I believe, at a very young age. I'm the youngest of 7 kids. Wow. And in a big family. My parents, neither of my parents went to college. It was the goal of both of my parents, but primarily my father, to see all of his children get through college. That was a primary thing. So I was the last to come along. They were much older by the time I came along compared to my oldest brother, who was 20 years older than me.
Oh my.
So when I came up with the idea of perhaps being a doctor, what they saw was lots more years of education. And so the finish line did not become 4 years of college. It became more like 11 years or something, whatever it was going to be. So I think that they were always happy that I might be interested in that. Unfortunately, they did not see me even graduate from college. They both passed away before I graduated, but I was able to continue on and become a doctor. I think the thing that really drew me to healthcare and being a physician specifically was my love for being with people and helping people. And I know that sounds like a cliche, but even as a teenager, I remember when all of the rest of my family was scared to death of doctors, hospitals, anything to do with medicine. I kind of prided myself with being able to saunter into any medical facility and to feel very comfortable even at an early age. And this idea of being able to use the knowledge that I had in science, math, or problem solving in order to be helpful to other people was very attractive to me.
What made it then jump into pediatrics for yourself? What was your reason to go in a pediatric route?
I used to tell people in medical school that if I weren't a pediatrician, I would not be in medicine. I would most likely be a teacher, a counselor, an athletic coach, or something like that, because I love young people and I've loved young people, kids from the time that I was young. And I don't know, maybe it was that I always wanted a younger brother or sister and I never got one. But when I was going through medical school, and many physicians, medical students that go through medical school, we're looking for some role model. We're looking for someone that we come across that we can see ourselves in. So as I see this particular physician practicing or teaching, I can say, wow, I can see myself like that person. And so as I went through, I was constantly looking, where is my role model? Where is the person that I can say, I see myself in that person? So I was waiting for my pediatric rotation to come along with anxious anticipation. I was an undergraduate major in biomedical engineering, so I had some interest in kind of cardiology, some of the more technical things, never surgery. I did not like the life of a surgeon and what that involved. However, when pediatrics came along, I saw physicians, especially in my resident physicians that were supervising me, people who were compassionate, people who were kind, people who were not trying to beat you down and trying to point out everything that you did wrong. And I saw an opportunity to really be present to not only the children, but also the families, the parents. And I always say, if you're interested in pediatrics, you better be interested in working with parents, not kids, because that's who you primarily deal with. And so when I came along, I was fortunate to have a role model when I was in medical school who was a senior pediatric resident. And she took me under her wing. And when she finished residency, and I went to school in Richmond, Virginia, and she set up her practice there in Richmond. And she invited me as a medical student to come into the community and into her office with her to help her out, because she extended her office into the surrounding community that she served with teaching in the schools, doing health education, doing health fairs, and appearing at community meetings. And I modeled my career after her career, just the way that she showed me how to be a pediatrician.
Yeah. I'm sure in your conversations with physicians in the work that you do now, there's a lot of them that wish they had that mentorship or modeling along the way, which I think probably puts you light years ahead of anybody else that you graduated with.
I would say several people found their role models. Most of us found many more negative role models than we did positive. So checking things off the list was a lot easier. I don't want to be like that person. Does that specialty does that person represent that specialty, or is that unique to that personality? So I would say that many of my classmates found their role models, or perhaps they already had the idea of what they wanted to do and they stuck with it. but several of us changed our minds as we went along.
Okay. All right. So then there's this transition that takes place at the end of your storied career, if you wish, of being around that, where you're really trying to help people, practitioners, find their purpose, build a healthier workplace and relationships. So what made that transition come about?
Well, this is a bit more complex, I would say, because as I went through my medical career, I would say as I was entering into medicine, like I told you, my parents passed away in my senior year of college. And I had in the back of my mind the interest of counseling, of teaching, of coaching athletics.
Mm-hmm.
And as I went to medical school, a good friend of mine, a classmate from my undergraduate school, was in the same city, and he was a teacher at a high school. He coached on a team. He was also working in the guidance counseling office or whatever. So I would look at him kind of going, okay, that's my life I could have had. Now I've got, the next 7-8 years of drudgery or whatever before I get to do what I want to do. So that was a true challenge. But I always had that interest, the counseling interest, the teaching interest, this interest of getting to know people at a deeper level. So as I went through my career, both internationally, working in Uganda as well as in Bolivia and South America, and bringing trainees into community settings, just like I said, my role model and mentor did. Mm-hmm. That's what I was really all about. And working with teams of people to try to bring a more well-rounded, interdisciplinary, and holistic approach to healthcare to the families we served. When I found myself in those settings where I was able to do that, I felt I thrived. Mm-hmm. When I found myself in jobs where it's kind of like sit in the office, see the patients, get the work done, then I went downhill. It was really a little bit of a roller coaster career. I changed jobs very frequently. I would say I never had one job for more than 5 years that I can remember. I was never the kind of person that either wanted to settle in a practice and retire in that same practice, or to be part of an academic department and, work my way up the ranks. I was always someone that was open to what's the opportunity ahead of me? Where do I feel called next? Fortunately, I married a life partner who had a similar outlook on life. So that's why it took us to all these other places. But what I found finally, when we returned, especially from Bolivia, we lived there for 4 years with our 2 kids. We were part of a mission organization. And in Bolivia, I worked at an organization whose mission was Salud Integral. So basically integrated health. But the way they looked at health was not like integrative medicine where we say, oh yeah, we have people who are naturopaths and acupuncturists and chiropractors and all these different things. They looked at health as economic health, community health, educational health, biomedical health, in that direction. So my wife and I immersed ourselves into this NGO, non-governmental organization, who was serving the population of mostly indigenous Andean people in Bolivia. And I found that this was an amazing way for me to use all of these interests that I had: counseling, education, medicine, everything in one. When I returned with our family after that, I got plugged into a job of working in a clinic that was educating pediatric residents, serving an inner city population. Everything looked good on paper and in the surface, but the attitude and culture that I brought in of trying to be the answer to fix a broken system that I was working under was something that brought me again downhill. It led to more and more investment of my energy and my time doing things that I felt were not necessarily my calling and what I truly wanted to be doing, but things that I thought needed to be done and would be pleasing to other people if I was able to accomplish.
Yeah.
And when your external work and environment and culture is not congruent with who you are inside, then your body kind of absorbs that. Your mental state absorbs that. And unfortunately, I became very anxious and depressed and ended up having to walk away from that job. The good part about that is that after a lot of struggle and counseling, therapy, coaching, just every type of modality there was, I was able to really look back over my career and find out where I was really motivated and who I am and how to bring that into the world. So as I re-entered working part-time in positions that were much more congruent with who I was, and it was subtle. I'll tell you, it was subtle because, like I say, on the outside, everyone else would say he's doing great. He looks great. He's having a good time and enjoying what he does. But I was able to reintegrate back into medicine in certain roles. And at the same time, I wanted to do this for other people. I wanted to be able to help support them in finding out where they can bring who they are to what they do, or soul to role, which I learned from Parker Palmer in the Center for Courage and Renewal, where I went on several retreats and became a facilitator in leading retreats for health professionals. And so that's how I got interested in what I do now. And so individual coaching and doing retreats for groups is kind of my new calling.
Yeah. Well, it is a blessing in the end that it turns out that way. I think always it's always difficult to go through that change. We were talking about that with some changes that are happening, here in my family, and the door is there to open. We don't want to grab the handle. We maybe want to take a peek, but we're afraid of what's there. We'd rather there be two doors and take a 50-50 shot that, hey, I'll take the one that's the comfortable zone versus the uncomfortable one. It's always hard. So you're able to go back yourself, realize the difficult struggles that you didn't want to go through that were presented to you. And that brings you the ability to change and say, okay, now I want people to have that freedom of feeling that I have achieved to help them. And I don't think people can understand how important that is, versus if I just say, okay, now I'm going to be a career coach, when I didn't have the struggles to get there. It allows you to carry people through that. That's more. So that brings me to kind of when it comes to counseling, mental health, let's just say, there's people are afraid to get it. They're afraid of what others will think when they do it. Do you think there are misconceptions in physicians right now that say, I'm feeling burnt out, I'm not sure if I'm happy in my path, should I actually reach out to Dr. Sherman and get some help?
Yeah, I think it's important to make the distinction between counseling, therapy, mentorship, and coaching, because I do think that they're different. There's a lot of crossover, but they are different. My wife's a clinical psychologist. She is a trauma therapist. She works with several physicians and other therapists as her clients. And she works on very specific things that they have experienced in their lives to lead to some dysfunction and some issues that really prevent them from moving forward. And so they really want to dig deep with certain modalities to try to make change that's really going to make significant impact in their lives. So that's kind of a therapy counseling role. A mentor role is somebody who, say, for instance, my role model when I was in medical school, that's someone who's walked the path that you would like to walk. They're ahead of you on that path. And so they can kind of help bring you and guide you along that path. A coach, on the other hand, walks alongside of you. A coach is walking alongside of you, believing that you are fully resourced and creative and capable of coming to the choices that make the most sense in your life. The problem is that you're stuck. You have limiting beliefs. You have certain boundaries. You have certain things that get in the way. And so that a coach is able to ask you the right questions, to provide certain tools and instruments to help you do that self-exploration so that you can access that and motivate you to make the changes that you need to make. So those are the kind of differences. Now, as far as physicians, I say we because I include myself, because the first time that I ever went for mental health support was early in my career, my first year out of residency.
Wow.
My first job I fell apart. I had anxiety attacks. I was really a mess because it was a misplacement. It was not what I was meant to do. And so I went to my physician who kind of checked out all my physical symptoms and fortunately referred me for therapy. And I was able to go to a psychiatrist at the time. And I remember at the time when I was listening to what that psychiatrist thought about what was going on. And he at first said, I can't really help you. And I said, what are you talking? He said, you have built up a world where you work and work and work so hard. And the affirmation and validation you get from that builds you up to gives you this kind of jolt, this high of that affirmation. And you're looking to try to make space in your life for relationships and a life partner and things, but you don't have any space because you filled it all up with all of this. So unless you're ready to let go of something, then you're not going to be able to bring anything else back in. And so that was the first time that I realized, boy, I do have to make some changes in my life. And this idea that medicine as a vocation and a calling that I give my entire life to and everything else is secondary to that, kind of like the Marcus Welby image or whatever it might be, where the whole world kind of just works around you and supports you so that you can move forward in your life. It doesn't work. It's a myth. And so you need to make room. You need to set boundaries. You need to set limitations for your own well-being and your own health in order for you to serve other people to the best of your ability and to be more present.
Yeah. Again, it's where your life has come into play. The struggles that you've had, unfortunately, that make you the coach, the mentor that everybody needs in their life. And I'm sure a real estate agent could use the same benefit from it as well. It's just that your niche is in the healthcare, which, it's a needed entity for sure.
And I think that there's a culture in healthcare, especially with physicians, that we can do it ourselves. We can go it alone. We don't need help. We have to tough it out because we did have to tough it out through medical school, residency, everything else. And so that's what we were taught. We were delivered that culture. So the idea of asking for help when we really do feel stuck brings a tremendous sense of shame of, oh, we couldn't do it. We couldn't hack it.
Yeah.
We're the ones that everybody else talks about that. Oh yeah, that one. Yeah.
Yeah.
But unfortunately, the reality is we're all human and we all need help at some point in time. And I would say, like I say, I have been a pediatrician since 1988 when I finished residency. And being a physician in this day and age is much more stressful than it was back when I first started. Much more. The communication, the information, the access, the technology, it's overwhelming.
Yeah. Yeah. Unfortunately, it's there to help us, but it also does become overwhelming. So, Dr. Sherman, what are some of the common issues that will bring physicians to you for your coaching?
Sure. I would say my coaching lies in about 3, maybe 4 areas. The first area is someone that feels like they're a bit lost or stuck with what they're doing. They feel disillusioned in their work. Maybe they feel like all they do is administrative work all day when they really want to see patients. Maybe they feel like they're on the computer night and day and they're not really doing what they love to do. Maybe they feel like there seems to be no way out. I don't have another option because the grass isn't greener on the other side. I talked to my friend from residency. They're having the same problem, and they're in academic medicine when I'm in private practice or whatever it might be. The other area that I work with people is in an area of kind of, they're at a crossroads already. They've already decided that they want to go one way or another, and they want to make that decision much more intentionally than before. Before, it might have been haphazard, and they found that when they got to the other side, they found themselves in a mismatch again. So they want to be more intentional, and they want to make that decision, whether I go into academic medicine, whether I go to private practice, do I take that employed job versus staying on my own, whatever it is. And then the third area is an area where is leadership, are people who find themselves in that leadership role, and now they're trying to make that transition from clinical medicine to administration, to being a leader. And how do you do that and have the confidence that your gifts can be valuable to the leadership team without the MBA or without the Masters of Health Administration or whatever it is that all the other C-suite people have. Yeah. And so there's a huge imposter syndrome that goes on with especially physicians, but any health professional that finds themselves in that position. And being able to understand yourself, being able to know what gifts that you do bring to that position, and to be humble enough to ask for help and delegate effectively to other people and trust them that they're going to help you do your job effectively.
Yeah. So is it in that process that you then realize that one-on-one is a fantastic way to do it, but working in a group setting, like doing your retreats, is that what got you to say, okay, I can help more people, in that group setting?
I would say I work in the group setting in two different venues. One venue is to take a medical team. Usually it's a interdisciplinary medical team. It could be an office staff, outpatient office staff that includes everyone from the front desk to the medical director of the clinic, whatever it might be, and bring that group together to try to create more of a sense of community among them. Or it may be individuals that are coming together, that individual physicians coming together that want to get away out of the atmosphere and the surroundings that feel like they're boxed in, and to try to do some self-exploration and to understand by working with other colleagues and peers who they may not have met until that weekend, and try to see where their life journeys paralleled other people's life journeys and how they can learn from each other, and being able to present certain prompts, certain exploration activities into how you got to where you are and where you want to go, and then step back and to see people interact with each other and the magic happen is a marvel for me.
Yeah. Yeah. So can that be uncomfortable at times? In other words, if there's a practice that has 12 people in it, some are introverts, some are extroverts, you give them some prompts, and they may work next to one another, but they don't know one another. So how does that work when, the team settings come into play in your retreats?
Yeah, that's a good question. I was fortunate enough to go through a program, like I said, through the Center for Courage and Renewal, where I trained to be a facilitator for groups of people who have various personality types, and some of whom will speak up, some of whom don't want to speak up. When do you encourage somebody? When do you just let them be who they are? And establishing certain touchstones or norms of interacting in the group, and giving people opportunities to share one-on-one with one person, or share in a group of 3 to 5 people, or share in a large circle of people. So providing different modalities of sharing is just one technique of making accommodations for all different types of people.
Yeah, because I've been in some sales meetings where you sit across from a person, you're lined up on one side, and there's other chairs on the other side, like speed dating, but speed selling, if you wish. And boy, can that be uncomfortable. Depending, like for me, I'm okay to have a conversation with anybody, but that person across from me that isn't, like, they can't look at you, looking down, looking up, just sweating, waiting to get out of that. So I'm sure that it's because the truth is, I can only imagine that the benefit that your clients get, whether it's one-on-one or the retreats, helps them individually, as a family, as a team, and then truly, more importantly, patient care as the end product. Because the better they are as a provider, when you feel mentally, at your best, physically at your best, then you can take care of your patients the same way. So with these retreats or one-on-one coaching, you're helping them through the burnout, through the stress that's in there. And then again, it turns around and helps them through patient care at the end.
Absolutely. All the work that I do is future oriented. It is, how do I move forward? How do I make the changes that are necessary to make, whether that's self-care, self-compassion, whether that's setting boundaries so that I can live a fuller life and be more present to my patients as well as more present to my family when I'm at home, whatever that is. And the first step in any of that is to establish as safe an atmosphere and a container that I can, whether that's with a group of people or an individual. Meet them where they are at first, try to establish that trust. And it takes some risk taking. It takes courage. So we often hesitate to say safe space because everyone has a different definition of what safety is for them. So I say more of a brave or courageous space where people are willing to take risks and willing to be vulnerable. But in order to do that, there has to be a trust that's established. And that's whether that's me working one-on-one with someone or whether that's gathering a group of people together.
Yeah. And you already have that built in from your practice of trying to gain trust of a little child, and the parent of a little child. You've had so many nuances along the way. And then you just take that big older person that's still a little kid inside and scared, and you're able to use all of those to help them along the way too.
Absolutely. Yeah. I think and this is something that I think a lot of physicians who consider making a shift in their careers, like you've made a shift in your career. And a lot of people who come to that state in their careers where they feel like perhaps they were doing clinical work for several years and they feel like this is not their calling anymore. This is not where they have joy, where they find joy. So they want to make a shift. And many physicians feel like, oh, I don't know how to do anything else. All I know how to do is see patients. I've been doing this since I graduated from college, and I just don't have any other skills. Like, I don't know what to write on a resume if I was going to do something outside of medicine. And I said, do you know the difference between writing a CV, curriculum vitae, versus writing a resume? In a resume, you say, what are your skills, right? And these are general skills. So I said, you are a problem solver. You're a communicator. You are a counselor. You're a leader. You're an educator. You are all of these different skills that you have by being a physician. It's just naturally part of what you do. Those are all skills you can bring to any other type of career.
I love it. For me, when I was in practice, I realized that I wasn't having the fun that I started with. And as a chiropractor, working on, like, laying hands on somebody, the energy that came from me into another human, I was saying to myself, it wasn't fair for them. Like, I never cheapened my care. It was always the best I did. But in the back of my mind, I was like, do I really want to be here? That's not who you want as a doctor working with you. And when you deal with physicians that are burning out in practice, and if that's a cardiac surgeon, and they are, they're like, I have to go into work today. Do you want that cardiac surgeon that's going through a burnout stage to be the one that's, opening you up and work? They will do their very best, but there's just that little bit of, the little gremlin on their shoulder that says, but you could be doing this instead. So that's a hard, like, and that's what the general population doesn't understand of the struggles with physicians. And I was reading on LinkedIn a post that a physician made. He said, the worst day in my practice is when a son of a parent came up to me and said, you killed my mom. And there was no intention of that. Life happens. It's a horrible, like, I was never in that situation. I had some very unique ways in which I did help people in a positive way, never in a negative way. But the heartbreak that physician experienced when he didn't go to work that day to hurt a single soul, and he hurt that woman, that family, everything. And that's like, what does a typical, you would know this better than I, what does a typical practice or a hospital do when somebody's in that situation?
I'll tell you nothing. And this is the problem. This is when something like that happens. I mean, can you imagine being in that position and being alone and having no one to go to and say, first of all, that was extremely painful. That was devastating to me. And how do I not go down into a spiral of guilt and shame and feel like there's no way that I can continue to be a medical provider anymore because I kill people as opposed to help people? Mm-hmm. How can you take that and process it all by yourself? I mean, I can't imagine anyone doing that. And so unless you have someone, go ahead, sorry.
No, I didn't mean it, but then have to go back and treat another patient right after
Absolutely, right away. Right away. And I found myself in that role over and over and over again, especially I would say in my training and residency, because back then I was facing many more life and death situations in medical school and residency. And when you're in the hospital and you're in the ICU, you're seeing very critically ill people, especially children. Yeah. And I remember the first month of my residency as a pediatric resident, and my first patient who I lost, who died. Mm. And this was back in the mid 80s. And it was a child who had congenital HIV, like a terminal child. And this was before we knew anything about HIV. We just knew it was a virus. Mm-hmm. We didn't really understand how it was passed on from an infected mom to a baby. And this child had it. We didn't have anything to do for that baby. And I say baby, by that time she was about 2 years old, and she died. And this was in the ICU. And I came in the morning and I said, where's the patient? That was primarily my patient. And very kind of nonchalantly, the ICU staff said, oh, she passed away last night. And that was it. And we have rounds in 5 minutes. Let's go. And I excused myself. I went to the hospital chapel. And I sat there and I cried and cried. And there was no one in the hospital, no one in the team, no other resident at that moment that I could go to and say, this is devastating for me. Please help me get through this. So I had to just kind of bury it. Fortunately, I had people outside of medicine at the time that I could go to. Yeah. But if you imagine that happening to people, or any devastation of someone who comes to you and says something like that, you killed, oh my God. Yeah. You have to have someone that you can go to that can support you, can hold you in some way, and to say, I'm here for you, and how can I help you be there for yourself in the future?
So there needs to be more Dr. Shermans out there, right?
I think we all have this capability if we really want to be. Yeah.
So unfortunately, I would say, are you noticing that there is more of a need for your service as of late?
Absolutely. I would, if you look at the numbers, just as from the burnout perspective, I would say that usually, depending on the specialty, somewhere around 50% of practicing physicians are burned out, who claim that they're burned out. And like you say, when you were...
that make the statement that they are, but the other 50% aren't willing to say it. They're afraid.
Yeah. And you're saying, like you were saying, you were going in and you had the awareness that your patient was not getting all of you. You had that awareness that... And you can imagine that patients who go in, I mean, I know that this isn't exactly extrapolating, but 50% of the time, the person in front of you doesn't want to be there.
Yeah.
I mean, that's, yeah, that's terrible.
Yeah.
And so I would say that the need to have coaches, depending on where you are, whether it's therapy, counseling, coaching, whatever it is, whatever you feel comfortable with initially. But I would say the need for coaching is necessary. And I think this is being recognized more and more in medical training as well as in practices and institutions. So we're starting to gain a little bit more momentum and recognition of the benefit of coaching, of having someone there. But I would say that not near enough given the amount of stress that medical providers are under these days.
Yeah. Yeah. I can imagine my wife works in the physical therapy field, and, there's a big burnout factor in that as well. And again, it's the people on top want you to see more, do more, see more, do more. And, when you've got 3-4 patients on tables all around, and you can't, we know that we can't do multitasking, and then you have to multitask with somebody's health. So it's a hard position. And it's because the people on the top need to show numbers, stats, and ultimately ROI on what's being done. So that is business, but you have to do your best to make sure that isn't there. So Dr. Sherman, I want to ask you about your business in general. What is your focus on your coaching, mentoring, retreat business? Like what's the focus of your business right now?
The focus of my business is to try to provide a brave, courageous, safe container for people who need some accompaniment, some support in helping them through a challenging situation that they're in their careers, or a transition that they're making in their careers, and to try to help them bring who they are to what they do more authentically. And by creating the space in their lives to be present as themselves to whoever's in front of them.
Okay. So do you have challenges in your business of reaching those people?
Absolutely. It is challenging. Right now, I do it mostly. I would say the predominant method of marketing for me is through word of mouth, through former clients that I have had who spread the word to other people. I also sometimes work with medical teams that then individuals from those teams will come to me for individual coaching.
Okay.
I approach people in leadership positions of medical teams or of organizations that would like me to either do a presentation, a workshop on certain themes that are very significant and relevant in healthcare today. I just led a workshop on the state of belonging, the sense of belonging in a hospital for all of their hospital staff, of what does that mean to provide a culture of belonging where everyone feels like their contribution counts. So I get this through contacts of leaders, through word of mouth, and also by being listed on various websites. And and I have my own website. People can get information of articles I've written, podcasts I've appeared on, my services, explanations with testimonials of people who I've worked with at any point in time.
Yeah, we'll make sure we share all those links in the show notes. But I would like you to share a success story if you have, like of somebody in your, I'm sure you've got thousands of success stories as a pediatrician, and I'm sure you'll get to 1,000 of success stories as the coach that you're in. But can you share a success story of one of the clients that you've worked with?
Sure. This is a story of a pediatrician, as a matter of fact, a pediatrician that I was working with who really wanted to break out of the mold of the kind of classic primary care pediatrician that was just kind of churning out the patients every day. And she wanted to expand to do more integrative health. And she was very interested in integrative health, especially as it applied to pediatrics. So when she came to me initially, she was working as a pediatrician. She was finishing up a fellowship in integrative medicine. And she wanted to somehow integrate that into her practice to eventually have her own practice of integrative pediatrics that she could do.
Okay.
She was in a group at the time, and she, first of all, wanted help to figure out, how do I present this as an option to my employer? Because the rest of my colleagues who are in general pediatrics working with me would love to refer internally their patients who parents that want more of this holistic approach. So I know that it's there amongst my colleagues. So I helped her to gain the confidence and the self-advocacy ability to go to her leaders to request making room in her schedule to have an integrative pediatric clinic. And then eventually, after a couple of more years of doing that, then working with her periodically to then break out on her own to where she now has her own integrative pediatric practice.
Yeah.
So she's gone from having this idea, this kind of seminal idea inside of her head, to actually making that dream come true.
Yeah. It's so good to hear, because too many people have it inside of what they want. And I think it goes back to maybe what we were talking about earlier, is that they're afraid to ask for the help. They're like, I want to do this. I should do it on my own. I just don't know what to do. And I'm sure it still wasn't easy, but I'm sure you made it much easier along the way for her to find what she wanted, kind of look at that purpose that she wanted to do, then find the next steps to make it happen.
Absolutely. Absolutely. And it was all about values-based decision-making. What are her core values? How do they fit into where she is? And if they don't, where do they fit in?
Yeah.
And move toward that.
Yeah. Well, I know for myself, I'm going to listen to this podcast a few times for a lot of the stuff that you said, even for my own business, which is great on how I can use this. But I'll share all of your links, Dr. Sherman, for people to get a hold of you. But if somebody's listening or watching this, I need to speak with Dr. Sherman, what's the best way in which they can get in touch with you?
You can email me directly at joe@joeshermanmd.com. And you can also go directly to my website, which is joeshermanmd.com. So it's pretty straightforward. There's no fancy names. It's just my name, and all the information is there.
Yeah. And again, as I said, I'll share that. So just two last questions for you on here,
Sure.
Dr. Sherman. From my overall health perspective, if there's one piece of advice you could give us all on living a healthier life, what would that advice be?
I would say expand your scope on what health means.
Okay.
What does health mean to you? And it's not just biomedical health. It is a more holistic approach. Way back in Bolivia, I learned this from the indigenous people of the Andes, is that health can mean a lot more than just whether you're sick or well biomedically. So expand your view of what health means to you. And if that means doing more in the community, or getting more exercise, or being financially stable and secure, or having the connections and friends that you really want to have. The healthcare statistics show that the absence of infectious disease, the absence of trauma, even the prevention of things like cancer or diseases that are controllable through behaviors, that does not determine a country's longevity or life expectancy. It's the culture of the country. If they have a more collective community culture and people feel like they belong and that they have some purpose in life through all of their lives, then they tend to live longer and live fuller lives. Yeah. So expand that view.
Yeah. Something similar to that off a little bit is I dated a girl when I was in school. Her family was from Eastern Europe, Croatia. And I wasn't here in the States. When our parents get old, we put them in a home, unfortunately. From Eastern Europe, where I saw that, Mexican culture is the same way. When our parents get old, we bring them into our home. So it's that surrounding. So when you have a culture that has a surrounding of, we want everybody to do well, versus unfortunately what's happening in our country right now, we have 50% that want to do better and 50% that want to do better and don't want to cross that line. So I'm not trying to bring politics into play, but I can see where a cultural component gives people a better blessing for their lives and overall health.
Absolutely. Yes.
All right, last question. You've been a guest on the Prime Health podcast. I appreciate that. What is your definition of Prime Health?
My definition of prime health is, again, I go back to that same definition. It's physical, spiritual, emotional, everything that you could imagine. It's that holistic approach where you feel that you accept yourself for who you are and realize that reality, set out the goals that you have for all of those different aspects, and be able to take advantage of whatever resources you have to attain that well-rounded health.
Well, thank you for sharing that. I appreciate it. Everybody's, answer is always different, and I take it to heart as to what everybody believes, and those are, because I need to improve myself from the answers that I get from people. So it's very good. Yeah.
Me too.
So, Dr. Sherman, I want to thank you very much for being a guest. It's been an exceptional experience for me. As I said, I'll definitely go back and listen to this a few times. Not that I don't for the others, but it's been the reason I do the podcast is I want to help patients. I want to help physicians. I want to help practices grow. This podcast has the ability to help patients, even though it was very physician based, help them on themselves. It has the ability of helping the physicians. So it's capturing all of those components. And I always say this, that as you listen or watch to this, if there's one person that can take advantage of what's been said, please share it with them. Yes, it's a selfish request because it grows our reach. That's business in general. But the truth is, there's somebody that's struggling in practice. There's somebody that's struggling in life. Can they listen and or learn from what you had to say to improve? I think so. So I always ask that people do that. And then selfishly, of course, business-wise, please subscribe to the Prime Health podcast. That always helps. We're always looking to reach that. So as I wrap this up, until next time, remember that, wellness is a journey. We're all on it together. Whether you're taking charge of your own health or you're helping others and guiding theirs, every step forward matters. So I always say, stay committed to your Prime Health journey. And again, Dr. Sherman, thank you very much for being a guest on the Prime Health podcast.
Thanks so much for having me, Derek.